Hello again. I'm Miguel, and this is level 3 blending of medicinal herbs and complementary alternative medicine. Just like we do with essential oils, with herbs, we put them together depending on their properties, on their benefits, on their therapeutic worth. And we're going to go over some of the mixtures that we have used in our practice and that we have seen perform. And we're going to share with you, as always, the time frame of performance, which is very important when you begin to work with essential oils and herbs and tinctures, is for you to be able to relate to an individual that you're consulting the time frame. When are they going to feel the difference or see a difference? When are they going to be relieved with what you're doing, with what you're recommending? And that's a key point in our practice. We want to be able to have a time frame, because just to say this material is great for this with a time frame, it's not saying much. It's just relating information from research and so forth and so on. So we want to make sure that before we recommend anything to anybody, we have an idea, because we have seen it before through the years, of when it's going to work. So I'm going to go over some of the herb blends that we use in our practice, and we have found it very effective. And I will share with you the time frame as we go on. In order to blend, and we make this very simple, so it's easy to follow. At the same time, we're always working with anti-inflammatories, remembering that all illnesses are inflammation. That made it easy for us to gather anti-inflammatories and begin to work with them. So the main 3 herbs that we work with in all the blends, as you will see, is calendula flower, lavender flower, and chamomile flower. All these are anti-inflammatories. All these are antibacterial. 2 of these are antiviral. So we have a really strong combination when we put this together. And remember the synergy effect with the essential oils. We are too utilizing the law of synergy when we are putting 2, 3, or more of the kind. So we begin with mixing equal parts of calendula, lavender, and chamomile. Now, by itself, this is the combination we use for the eye, for infections of the eyes, to bring down eye pressure. And we have seen that eye pressure come down within 1 application of this tea. Because the teas are not only to drink, and we also can take these properties of anti-inflammatory and apply it to the skin as a toner. So we're able to do that. And we can take some of the properties, such as eucalyptus, oregano, lavender, and make a tea, put in a spray bottle, and spray it as an insect repellent. Or lemongrass will be a good one to add to that. So when you look at the herbs and you look at the properties, not only can you use it to drink as a tea, but you can use it to apply to the skin. You can use it to spray for a mosquito repellent, and so forth. So we're working with the properties, and once again, we're transferring the knowledge we have of essential oils to the herb. Once again, the flavor of the tea is the essential oil. So in this combination, it will be equal parts of calendula, lavender, and chamomile. The way that we use it for tea, for substance, for eye infection or inflammation of the eyes, or excellent for those who work on fluorescent lights the whole day, if they do it once a week, which is what we recommend. Or for those, like I mentioned, that has high pressure. We make the tea, and then we take a cotton ball. We dip the cotton ball once the tea temperature is at room temperature. We squeeze the excess and then just lay it on the eye while we're laying down. The second that the liquid, the mixture, gets into the eye, the itching, if it's an infection, stops. And we can continue to do this as many times as we like. And what we have seen is that it will definitely relieve the infection, and in some cases we have seen, and this is anecdotal information, have taken care of the infection. And we want to recommend this while the person is waiting to see a doctor. Of course, this is complementary health care. So we work with medical consultation. They need to see a doctor if they're sick or suffering from illness. This is just an option to relieve the symptoms until they get to the doctor. So calendula, lavender, and chamomile by itself is also an excellent anti-inflammatory tea if we're going to leave it by itself. But if we want to make a tea that will be very effective for acid reflux, to this combination we add peppermint, and we add spearmint. Equal parts of the 5 of them. We recommend a level teaspoon per cup of hot steamy water to allow it to brew for 8 to 10 minutes and to drink. We know by using this through the years that someone who has acid reflux on medication is able to cut down or leave the medication because this tea works within a half a cup of drinking to a cup of drinking. Now, we recommend the person drinks this pretty much 4 to 6 cups a day as water, or definitely drink a cup at nighttime, which is when the person is laying down and acid reflux moves in. So this is really neat, and the people that have used this not only didn't have to take that medication which has a side effect, but also they have realized that if they change the way they feed the acid reflux, they won't have acid reflux. Because it's very hard to have an illness if you're not feeding it. So for that we look at the food. And the first one that pops to our mind is sodas or artificial drinks. Whoever you know that is drinking sodas or artificial drink, you can ask them, do you have acid reflux yet? Because they will have it. So once again we remove that and add anti-inflammatories. And peppermint spearmint makes this combination an excellent acid reflux tea. Now, let's say that we want to make a muscle ache tea to go with the muscle ache essential oil synergy or the muscle ache gel that we make for pain management. So if we want to make a muscle ache tea, we're going to add to this sage leaf. We're going to add to this marjoram, now we have muscle relaxers. We can also add to this, and I always add peppermint to it because it's always good for the stomach. I always add either peppermint or spearmint. And here, equal parts of this, well actually not equal parts of this, you want to have 3/4 of the sage, and then equal parts of calendula, lavender, chamomile, marjoram, and peppermint. Sage is your muscle relaxer. So you want to have 3/4 of the sage leaf, and then equal parts of the rest of them, which is calendula, lavender, chamomile, marjoram, and peppermint. Within a cup of this, and it's once again a level teaspoon per cup of hot steaming water, we don't boil the material, and no sugar. If you don't boil the herbs, you don't have to put sugar. It doesn't become bitter. It's also good to mention that when we're talking tea, and you're going to be talking to folks that are health conscious, and they think they're being very healthy by drinking tea from a tea bag. That's not what we're talking about. The bag is a paper or another material, so it's not the herb that you're making the tea from. If it has a staple, it's aluminum, a carcinogen, and then the string. So when we're working with herbs, we're working with loose herbs. In the United States, we get our herbs from either Frontier Co-op or we get our herbs from Mountain Rose. If you get your herbs from Frontier Co-op, and you can call Teresa, which is the wholesale department, and then you can get really good price for the herbs. Her name is Teresa. And that's from Frontier Co-op. But Mountain Rose also have equally nice herbs. In any other country that you might be listening to this, just hunt for a supply for herbs, and I'm sure you will find it. This is all over the world, since it's being used by all nationalities. Also, don't underestimate the power and the taste of fresh herbs for tea. Most of us have an herb garden, but we only look at it as a cooking garden. No, look at it as a tea garden also. So if you're able to grow marjoram, if you're able to grow sage, if you're able to grow peppermint, chamomile, marjoram, you're able to make a tea of fresh herbs. And it's delicious. Once again, no sugar. You don't need it. It is like making a soup of these beautiful herbs. So that is the muscle ache tea that we might recommend with muscle ache synergy of the gel. But let's say that we want to make a tincture of the benefits of these herbs. Then we can take this combination or any combination of herbs, place it in a mason jar, fill up halfway with this blend or any other blend, depending on the properties you're going for, and then fill it up with vodka, 100 proof vodka. And in 2 weeks, the alcohol will take the properties of the herbs, and then it will do one more thing that water doesn't do. It begins to ferment because of the aromatic alcohols. And 20 drops of that tincture in a glass of water, wait 5 minutes so the alcohol is gone, and then you can drink it. And it will have amazing effect because the tincture takes out more of the property of the herbs than in distillation or in tea form, in water. So the tincture is very strong, and we can carry our formulations into tincture form. So let's say that we're working with somebody who is taking a lot of medications with a lot of side effects which are inflammatory, and we want to surround their daily life with muscle relaxers. So we would recommend the tea, the application of the muscle ache synergy or the gel, and then we would recommend the tincture, and especially the tea or the tincture at nighttime before they go to bed, because inflammation moves in at nighttime. Of course, that's after we have checked out the air they breathe, the water they drink, the beverage they drink, because they could be on the food that they eat, because they could be feeding their inflammation. So that's when we replace it with anti-inflammatory food. So remember to focus on the 4 areas of good health. Now we find that that's the one, when we do the 4 of them, we're able to see a change. Because within those areas, there's a chemical that could be the cause of the illness. Once again, if whoever needs a pill needs a pill. We have no problem, and we support medical practice. I mean, we need that. We need both in order to have a healthier person. So it's a combination of both that works right now, and it works very nicely, as we will see. Now, if I want to make this sinus and cold tea, I'm going to go ahead and add to this sinus and cold herbs. So eucalyptus will be the first one, eucalyptus leaf. Then oregano. There's 3 antivirals that nobody can deny, which is onion, garlic, and oregano. I don't know why it doesn't kill. So whenever you're going for antivirals, antibacterial, oregano you can't go wrong with. And oregano tea has been connected with being very effective against MRSA. And we're going to give you those studies so you can have them and use as a guidance. So oregano, just the tea itself, an oregano leaf from the garden, squeeze and place in a cup and fill it up with hot water, wait 8 minutes, and the essential of oregano will be in the water, and we recommend it for drinking. If you don't have the rest of the herbs and you have oregano, that's the one you want to drink when you're sick. But let's see, what else do we add for the sinus and cold? We have eucalyptus, oregano, oh, rosehip. Rosehip is your vitamin C. Try to get the rosehip that are crushed. If you get the whole rosehip, beware that the needles inside are very penetrating and prickly. So wear gloves when you're smashing them and cleaning, but it's best to get the rosehip that is clean, crushed and clean. So now we have antiviral, vitamin C, antiviral, anti-inflammatory. And then of course we have peppermint, or spearmint, whichever you like. Now we have the sinus and cold tea that we have been using for many years. This, just like the other tea, we use with sinus and cold synergy. And we can use it with a sinus and cold salve, which is a chest rub, with the essential oils for sinus and cold that we use in the essential oil synergy. And if we place this combination in a mason jar, the same as we did before, fill it halfway, fill it up with vodka, in 2 weeks, we now have the properties of all these herbs into the tincture, and they have fermented, and we can use 20 drops of that, again, in a glass of water. It could be hot water, it could be cold water, and wait 5 minutes. The alcohol is gone. Recommended for those who have sinus and cold problem. But we got to look at the air they breathe, and of course the other three areas of good health or bad health. So this is the sinus and cold tea. Now let's see what else we're able to make. Let's make an antidepressant tea, which can go with the de-emotion synergy, and then we can make the antidepressant tincture, just like with the other ones. So for antidepressant, we're going to add marjoram. Remember, marjoram essential oil, the properties. And then we're going to add valerian. That's valerian root, validated as an antidepressant, also insomnia. And then we're going to add, if they're not on cancer medication, if they're not on birth control, because it will interfere with those, we're going to add St. John's wort. And once again, equal parts of the 6. We can add to this tilo, or linden flowers, which is also tilo. In Latin countries, linden flowers. Or we could add jasmine flowers. Or we could add rose petal. And all this are relaxing. Some of this have been validated. Once again, for depression, which is this and this. And we know marjoram from the essential oils is an excellent relaxer. So by putting together this mixture, and of course add peppermint to it, which is what I do. I mean, you can change this around to whatever your knowledge is, because that's another thing. Which whatever we do, you're adding your knowledge. Some of you I've talked to, you have been working with essential oils and herbs for many years. So you're able to add what you know and change this around to make your own blends. But for now, I can share with you what we have used and the time frame. And we know that when somebody takes a half a cup of this, they don't need scientific validation to know they're sedated. Very powerful. Once again, we recommend a couple of cups before bedtime. If this is also a good insomnia tea. You know, we have validation on lavender for insomnia. We have validation on chamomile for insomnia. make sure that the person is not allergic to ragweed. If it is, you can omit chamomile from any of the teas and just use calendula and lavender, and replace chamomile with either linden flowers or jasmine flowers. So it's good to ask if the person is allergic to ragweed before you add the chamomile. But it can be substituted for linden flower or jasmine. So we have validation on insomnia on lavender and chamomile and linden flowers and valerian. So this will make a very nice, and it does, a very nice insomnia tea. And if you place this into a mason jar and add vodka and make tincture, now you have a very powerful substance that 20 drops in a cup of water before they go to bed has allowed people to go to sleep without the use of their medication. And now the side effect of medication for insomnia is death. That's what they share. So it's okay to have an option for a better way to live without the side effects. I mean, if you need a pill, once again, you need a pill. But this is a great option for insomnia. And just the valerian tincture by itself, just the valerian tincture is a relaxing tincture, and it's also, just by itself, it has replaced insomnia medication, synthetic ones. So we're trying to reduce the side effects because there's not any science that can validate and give us predictable outcome on anyone with 5 or more medications. So whoever is on 5 or more medication, they are outside the science, outside the predictable outcome. So most of the medications are taken for side effects on the first one that you took. So this system allows the individual to stick with the medication that they need without the excess medication for the rest of the side effects of the first medication. So, and it works very nicely. So this is now the insomnia and the antidepressant tea. Remember, there's many ways to roam, so there's many ways of putting together the benefits of the plant material. Now let's do one for energy. These are relaxing, so we're going to keep this out of the energy one. And let's see. We're going to look at the energy essential oils, and we're going to use the herbs that have those essential oils. So we're going to use rosemary, basil, peppermint, and we're going to use here, we're going to use spearmint, and equal parts of this. And if I'm adding to this a tea for those who have nausea, then I will dust these herbs, just enough to cover them, with ginger. That has validation for nausea. Now, if somebody is pregnant, for nausea, we follow what the science is telling us, and the most sure way to take care of nausea during pregnancy is by cutting a lemon and smelling it, the fragrance, and the essential oils as you cut it, and also by cutting a piece of ginger and smelling it, because you're smelling the essential oils. So that's a safer way for someone who's pregnant to combat nausea. Or anyone that don't have all this combination of herbs that just want to take care of nausea, but we still pay attention to the air they breathe, because it could be chemicals that could be causing this. So equal parts of rosemary, basil, peppermint, spearmint, and ginger will make an excellent energy tea. And again, if I put this in a mixture in a mason jar, fill it with vodka, wait 2 weeks or 3 weeks, 10 to 20 drops in a glass of water, 5 minutes later, we're drinking a substance that will energize us. Not that to be placed in a water bottle that you take to work and drink in those hours that your energy goes down. Now, let's make a tea now for a toner for the face. We want lavender, which is anti-inflammatory and rushes circulation to the area. That's lavender herb. Now, if we use juniper berry, now we have a very strong astringent. It closes the pores. So, in lavender flower, a teaspoon of lavender flower, we crush about 6 to 10 juniper berries. Squeeze it, place it in the tea. Wait until 10 minutes or 14 minutes until the water cools down. Put it in a spritz bottle, and you can spritz it in your skin and let it dry by itself before makeup to close the pores. It gives you, the juniper berry, it gives you like a mini facelift. Where you use a few drops of the essential oils in water and then spritz it. And remember, the rule is 10 drops per ounce of water if you're using the essential oil, or if you're using this herb mixture in tea form, which is also in water. So this is very beneficial for that too. And you can do the anti-inflammatory calendula and chamomile and lavender as a skin toner and cleansing of makeup and so forth. So pretty much you can replace a lot of chemicals that you will use on your face. Now, one of the questions that comes up is, I don't want to take caffeine. So, some of the teas will have caffeine. Well, the way to deal with that is you make the first brew, and then in 1 minute of brewing, you take out the water. The caffeine comes out in the first 30 seconds to 60 seconds of brewing. So you take out the caffeine, put more hot water, now you don't have caffeine on that tea. So that's the way that we recommend for those that want to drink the tea but can't have the caffeine. It's a very simple way of doing it, and it's a very neat way to drink some teas before bedtime without the caffeine. So this have covered some of the herb blends that we use in our consultation, and I can assure you that this works in conjunction with the synergies. It works excellent as we use the same materials and the same properties, not only the essential oils in tea, but also in tincture. So, thank you for joining us. If you have any questions, email. It's good to hear from you. It's good to hear your feedback. Until then, we'll see you soon in another video. And remember, with this tea, there's hope, there's health. Thanks again for joining us.